usually high, sometimes higher than 30%, despite the fact that Listeria monocytogenes is treatable. This is because it is a very virulent organism, especially to neonates. As far as distribution is concerned, we have got the following situation. Gauteng is still number 1 at 61%. It means 442 out of the total of 727 cases occurred in Gauteng. Just to remind you, in December it was 62%. It was 345 cases out of 557. Today, they are at 447 out of 727, so it's 61%, not much change anyway. Western Cape is still number 2 at 13%. That means it's 92 out of the 727 cases. If I may remind you, in December, there was at 13%, it was 71 out of 557 cases, so there is no change. KwaZulu-Natal is still number 3 at 7%. 51 of the 727 cases are in KZN. In December, there was also at 7%. It was 37 of the 557 cases. So again here, there's no change. And 65% or 473 out of the 527 are occurring in the public sector. 473 out of the 723 are occurring in the public sector. That is 65%. In December, it was 66%. So, and the private sector is accounting for 35%. That means 251 out of the 723 cases are occurring in the private sector. It gives us 34%. So at the moment, there is not much in provincial, there's not much change in provincial distribution. There is no change at all in public-private distribution. The situation still stays the same, but all that is increasing, have increased are the numbers. The recent developments. Since the 5th of December 2017, the Department of Health amended the list of notifiable disease to include listeriosis. Prior to this outbreak, listeriosis was not a notifiable disease. For a disease to be notifiable, it has to meet at least two of 5 qualifying criteria. The first qualifying criteria is that the disease must be contagious or communicable. And as you know, listeria is definitely not contagious. It's not a communicable disease. The second qualifying criteria is that the disease must spread rapidly in the population. As you know, for the past 40 years, listeria was not spreading rapidly in the population. We used to have 60 to 80 cases per annum. We are now at 327. Criteria number 3 is that there must be unusual or unexpected behavior. Listeria was not behaving unusually or unexpectedly for 40 years. It has now started to do so. The fourth criteria is the risk of spilling across borders of other countries. Listeria was not yet doing so. Even now, it's not yet doing that. The fifth criteria is the risk of restriction to business or travel across borders. These criteria are according to the National Health Act and also according to the international health regulations of the World Health Organization. It is now evident that listeriosis does qualify in at least 2 of the 5 criteria, when previously it was not. And the 2 are rapid spread. You can see it's spreading very rapidly. And the second criteria is that the unusual or unexpected behavior. The behavior we're seeing from listeria, we never saw in the past 40 years. So for that reason, it qualifies for notifiability. So it is for this reason that the Department of Health introduced a new policy of making listeriosis notifiable, and this is appearing in Government Gazette number 41330 of 15 December 2017. That means we made listeria notifiable 10 days after our first press conference. We appeal to health workers to do the following. 1, report all cases of listeriosis in terms of reporting procedures applicable to all notifiable diseases. 2, to complete case investigation forms for patients with listeriosis and submit this to the NICD. The details are available on the NICD website. Let's come to the issue of genome sequencing analysis. This is very technical, but I thought I need to share it with you. Those who are technical minded will pick something out of it. In the efforts to scientifically trace the source of the outbreak of Listeria monocytogenes, a whole genome sequencing analysis, or what is called WGS, whole genome sequencing, is done. Whole genome sequencing is a DNA fingerprinting analysis to see whether particular organisms are related and are of the same sequence type. To this end, the NIC uses isolates from 3 different sources. That means to do genome sequencing, they get isolates for which they get the specimens, and they get them from 3 different sources. The first source is clinical isolates. That means isolates which are obtained from the blood of a sick patient. The second is food isolates. That is obtained from food that is found in the patient's home or any other locality, like a food production site or wherever food is found. The third is environmental isolates. These are obtained from the environment where food is produced. Like when we go to abattoir, within that environment, you can obtain isolates. So these 3 sources, from these 3 sources, the NICD will start conducting the whole genome sequencing. This work is ongoing, and it stretches back to the 1st of January 2017. And as of the 3rd of January this year, a total of 337 isolates have been sequenced to date. 73%, that means 247 out of the 337 isolates are clinical isolates. 22% or 74 out of the 337 are food isolates. 5% or 16 out of the 337 are food production environment isolates. The clinical isolates are represented by 9 sequence types, which the sequence types are abbreviated ST, meaning sequence type. So from the clinical isolates, that means the isolates taken from the blood of patients who were laboratory confirmed. There are 9 sequences, and just for information's sake, is ST1, ST101, ST2, ST219, ST5, ST54, ST6, ST8, and ST876. However, it was found that 91%, that means 225 of the 247 of these clinical isolates are sequence type 6 or ST6. And they are very closely related, representing a single strain of Listeria monocytogenes. The conclusion that could be obtained from what I said is that the strain that is causing this outbreak, which we are experiencing, is ST6 or sequence type number 6. We can now confirm that of all these 9 sequence types, number 6 is the one that is driving this, number 6 or ST6 is the one that is driving this epidemic. This ST6 strain has been identified in isolates from all 9 provinces, and these findings support the current working hypothesis of a single source of food contamination causing the outbreak. That is a single widely consumed food product or multiple food produced at a single facility is causing this isolate. At least we can now confirm that. The food and environmental samples are represented by 18 sequence types, and I'm not going to name them, but we have discovered that out of the 18 sequence types that represent the food and environmental samples, 4 types, that is ST1, ST101, ST2, and ST5, are also represented in the clinical isolates I've mentioned. However, there is no ST6. That means the strain that is driving this epidemic, we never found it in food or environmental isolates up to so far. We only identified it in patients, not in any food or environmental isolate. In simple language, it means we cannot yet link the clinical isolate obtained from patients to a particular foodstuff or a particular food production site environment. Unfortunately, this is where we are. We have got the patient isolates. We know now it's driven by sequence type number 6, but the other sequence types that are in food or from the environment cannot be linked to that. So we cannot then tell you that this is the source of this particular pandemic. Unfortunately, we are still searching. In their vigilance and continuing search for the source of Listeria outbreak, environmental health practitioners from the city of Tshwane in December 2017 investigated a Tshwane patient who was hospitalized with Listeriosis. A chicken sample collected from the fridge of the patient's home tested positive for Listeria. This chicken was traced back to the store, and from there traced back to the abattoir at which it was sourced. And the abattoir is called Sovereign Foods. The environmental health practitioners visited the abattoir and collected food and environmental samples, several of which tested positive for Listeria monocytogenes. As a precaution, the abattoir was served with a prohibition notice pending further investigation. The abattoir-related Listeria monocytogenes was subjected to the genome sequencing, as I've mentioned, to check which ST type it is. All the samples collected from the food and environment at the abattoir have up to so far failed to pick up the outbreak strain, which is ST6. That means in that abattoir, we found no ST6. However, other strains of Listeria with a potential to cause disease were picked up. Hence, that's why we put the prohibition notice for that public health facility not to distribute food. At this juncture, however, we cannot conclude that the abattoir called Sovereign Foods is the source of the present outbreak. We cannot link them, much as they've got Listeria. We can't point the finger at them and say they are the source of this, because that won't be scientifically true. But we can conclude that that abattoir has got Listeria, which can cause illness, and hence it was in the best interest of public health that the abattoir was prohibited from further preparing food pending the cleansing of the environment and the meeting certain conditions given to them. What concerns us the most, however, at this moment, is that this particular abattoir was closed 2 months ago, long before I called a press conference about Listeria. We discovered that it was disclosed by DAF, Department of Agriculture Forestry, following the discovery of unhygienic conditions and practices, which of course were not necessarily related to Listeria. These were preceded by environmental health investigations, which were conducted earlier in July 2017 by Tshwane Metropolitan Municipality, the findings of which were the existence of conditions that constitute what I will call a nuisance in the facility. This led to the delayed issuance of a certificate of acceptability at the time, until such time that corrective measures were implemented by the abattoir. A special meeting was held with all senior managers in Gauteng province on the 15th of December 2017 to inspect all food premises within the province with specific targets of food processing areas and retail foods. The Director General of the National Department of Health has formally requested food industry stakeholders to submit details of Listeria positive food items, environmental swabs, and Listeria isolates to the NICD. While several stakeholders have been forthcoming with information, unfortunately not all stakeholders have responded as yet. Environmental health practitioners from municipalities and provinces where positive cases are reported should embark on case investigation and trace the source of the infection. Clinical listeriosis management guidelines are also available on the website of the NICD and the NICD continues to operate on a 24-hour hotline to support healthcare workers. Work has commenced on implementation plan for the inspection of food processing facilities, including packaging and distribution plants for bigger retailers, and inspected by environmental health practitioners from municipalities, initially within the most affected district. That means within Gauteng, Western Cape, and KwaZulu-Natal. This type of work is going on. And samples taken to assess the quality of the food processing systems. The results will be used to guide public health interventions for listeriosis prevention and control. A multi-sectoral outbreak response team, MNORD, which I reported in December, which is led by the Department of Health and include the Department of Agriculture, Forestry and Fishery, the Department of Trade and Industry, the NICD, and other relevant stakeholders, will continue to monitor and coordinate the outbreak response activities. All South Africans should still practice basic food hygiene principles as outlined in the World Health Organization's 5 key safer food programs, and I won't tire to repeat them at every available opportunity. We call them the core commands of food hygiene. Number 1 is keep clean. Wash your hands before handling food and often during preparation. Separate raw and cooked food. Separate raw meat, poultry, and seafood from other foods. Don't handle them simultaneously. Cook thoroughly. Cook food thoroughly, especially meat, poultry, eggs, and seafood. Keep food at safe temperatures, either deep refrigeration or reheat foods correctly. And lastly, use safe water and raw materials. Use safe water or make it safe by boiling. Choose food processed for safety such as pasteurized dairy products. Wash fruits and vegetables thoroughly, especially if eaten raw. Today, I've got a special request to health workers and the public at large. In December 2017, we reported that while listeria can affect anybody from any socioeconomic background, there are certain categories of people who are specifically vulnerable. These are neonates, that means those who are less than 28 days of life, pregnant women, the elderly, and people with compromised immune systems, like people living with HIV and AIDS, people with diabetes, people with chronic disease like cancer, kidney and liver diseases. Those are vulnerable. However, when we view the statistics of affected people, we note that of all these vulnerable groups, neonates are the worst affected. If we analyze it by age from birth to 93 years, in this case, we noted that neonates alone account for close to 40% of these total cases. Is 39-point-something%. That's why I rounded up to close to 40%. Of note is that of all the neonates that get affected, 96% of them had early onset disease. That means 96% get the disease between birth and 6 days of life. It is clear that these neonates are simply vulnerable due to their pregnant mothers. They are infected at birth by their pregnant mothers. Due to this high number of neonates that are affected, a special request to health workers and the public at large is to pay special attention to all pregnant women. Please, when you are dealing with a pregnant woman, have a high index of suspicion. Whenever you are dealing with a pregnant woman or a neonate, be alert all the time, be it at the antenatal clinic, in the labor ward, or in the neonatology units. We are calling all health workers to be alert and have a high index of suspicion. High index of suspicion is that keep on thinking about listeria when you enter any neonatology or when you see any pregnant women at the antenatal care or any woman in labor. Keep on thinking about listeria and work accordingly. There are 1.2 million pregnant women in South Africa annually. In 2014, we launched a special program called Mom Connect, whereby we register every pregnant woman on the cell phone. Or rather, we register pregnant women, not every, those who come forward to register with us on the cell phone. We send them messages every 2 weeks, which are commensurate with their period of pregnancy. After birth, we switch the messages over to the care of the newborn. Since 2014, we've registered 1.96 million pregnant women in that program, and we've been sending the messages. Today, I've given instruction that all of them be sent instructions about Listeria. We are calling on more pregnant women to register on Mom Connect, be they in private health care or public health care, because it is during times like this when we are able to reach them quicker through messages. In other words, now that we have given this instruction, we can confirm that we can directly reach 1.96 million pregnant women or women who are still nursing their babies in their first year of life. We can reach them immediately and give them messages about Listeria. So it will be advisable, and it will be very good for the country if every woman who's pregnant can register on Mom Connect, because we can reach them quickly. Thank you very much. I'm sorry the statement was very long, but we thought we needed to give you all the updates and leave nothing behind. Thank you.
Thank you, Minister. Colleagues, again, my name is Bobo Mata. I'm speaking for the Department of Health. We are going to be asking you to ask questions. We'll take a set of 4 questions, and each colleague, please introduce yourself. I am aware that there are people who are here who are not journalists. Only journalists will be asked, would be the one who asks questions. Those interested parties may not necessarily ask the questions. Only the media would be.
Before questions, Popo, I want to find out if there's anything that the team here wants to say. The World Health Organization, the NICD, the Department of Agriculture, Trade and Industry, if anything needs to be added, not health, because I've spoken on behalf of health.
I could say a few words, Minister.
Yes, Dr. Chatora, get the gadgets. Get the gadgets. Yes.
Thank you, Minister. Senior government officials here, members of the media, ladies and gentlemen. I would like to start by congratulating South Africa for its openness in sharing detailed information on the Listeriosis outbreak since last December. This helps South Africa and the global community at large to protect health, to identify, to respond, and to control outbreaks where they occur, in keeping with the provisions of the international health regulations. Listeriosis outbreaks have happened in many countries, including France, the United States, and Denmark. But this is one of the largest outbreaks recorded. Listeriosis is a real challenge in health services because of its long incubation time, and because it involves so many sectors, not only health, but the food industry, as well as agriculture and farming. It's great to see how in South Africa, all these different sectors have come together to fight listeriosis. The country has implemented some very important measures, such as making listeriosis a notifiable disease for the first time ever. This is helping to track the disease. Investigating the cause of listeriosis is a real challenge. Listeria bacteria, as the minister has said, are found everywhere, and it thrives in refrigerated, ready-to-eat processed foods, which have a long shelf life. To further complicate matters, it takes about 3 weeks between when a person eats the food to when they start showing symptoms of listeriosis. Due to this long incubation period, it's hard to identify the source. The cases we see today reflect what happened at least 3 weeks ago. So even if a food source is identified today, we can expect to have cases to be reported over the next several weeks to come. This makes the investigation into the source of the outbreak particularly complex. National experts working on the outbreak have access to international guidelines on food processing and environmental hygiene with respect to factories, abattoirs, and primary production sites. The application of these guidelines is of course dependent on the current regulatory environment and the requirements of South Africa. It is important for everyone to respect these requirements if the country is to contain this outbreak. Even though we don't know the source of the current listeria outbreak, there are actions that WHO urges people to take, some of the things that the minister mentioned. I want to highlight that some people are at particular risk of severe outcomes. These are pregnant women, the elderly, and people with weakened immune systems. WHO recommends that if you are pregnant or living with HIV or cancer, that you avoid high-risk foods. This includes luncheon meats, deli meats like ham and sausages, meat spreads, smoked fish, and soft cheese made from unpasteurized milk, thoroughly cooked meat and chicken. With the listeriosis outbreak, we all should be extra vigilant. I want to end, Honorable Minister, by assuring you that WHO and the international community stands ready to support the Department of Health and other departments involved in fighting this outbreak. I thank you.
Thank you. Thank you. Colleagues, we will take a set of 4 questions. The minister will respond to those, and with a bit more of the team will respond to those. Shall we take? Yes.
Hi, Alex from News 24. Minister, I just want to find out what are the difficulties in tracing the cases, or tracing the actual patients, because if you look at the patients traced, I mean the mortality rate there is almost 50%. It's just under 50% in terms of those that you've actually traced and those that have already passed on. So I just would like to understand what the difficulty is in finding these patients. Because surely if you find the patients, it might also help us getting closer to the source. Thank you.
Okay. Another patient? Yes.
Good day, everyone. My name is Johnny Sai. I'm with African News Agency. Just to inquire, like my colleague did, on the issue of your tracing back the patients, what's the difficulty? Because when people check in at hospitals, they leave their addresses and...
Is it not the same question that he has asked?
It is, Minister. Let me just finish off, please. So I just wanted to check with that. But secondly, with the issue of the high mobility during the festive season, across the borders and come back here, have you also been checking there when people go out and when they come in, if they are not bringing the disease, or taking it further when they go out or come back? Thank you.
Thanks, Jeremy.
Yeah, sorry. No, I didn't want to intervene. I don't want to be rude. I thought it was the same question. He said I must allow him. Can I understand the difference between the two questions? What did you add to what he has already said, to what Alex has said?
My difference was the issue of home addresses, when patients leave their address, so what's the difficulty in tracing the patients? But the second thing was that with the borders, when you check the people go out and come back, the travelers, over the festive season. Thank you.
Thanks, John. Yes. Can you press yes.
Morning, Minister. I'm Snipe and Sile from Netlife 24 and Deal. I was just wondering, sorry. Seeing that most of the cases are neonates, I remember when I was pregnant with my son, my gynecologist was very strict on what I was allowed to eat and not to eat. Extremely strict. So I was just wondering, is there maybe another way? I know not all mothers have access to I know you have a program as well, but like I said, she was extremely strict on me on what I was allowed to eat. Not biltong, ham, anything like that. So I was just wondering, is there any way to help these mothers to let them know as a precaution? Thanks.
Thank you. So we'll take the last question for the background. Yes. No, you first.
Okay, thank you. Minister, it's Noni Mugati from Independent Media. I only have 2 questions for you. I just want to find out, in terms of clarity, the cases that have been reported, are they only in the public sector, or have you had cases as well in the private sector? My second question is to find out, in terms of the cases that have been reported and the number of deaths, and the people that are treated at hospitals, are hospitals basically winning when it comes to treating patients, or in terms of resources, etc.? Do you have enough resources to treat the patients? Thanks.
Thanks, Nani. Just be opportunistic and take...
No. Let me answer, please. Don't forget. Yes. My mind is tuned. Yes. Alex, yes. And Johnny, the difficulty in tracing patients. Firstly, Alex, the actual mortality up to so far is 45%, not 50%. We calculate at 45%. I've already mentioned that in all outbreaks it's usually more than 30%, so it falls within that range. Now, your questions, gentlemen, is assuming that every human being has got an address, which you all know is not true, especially for South Africa. You'll remember the Constitutional Court case about the registration for elections, that the issue of addresses was a very big issue. People from informal settlements don't necessarily have addresses. It's difficult to trace them. Even without listeria, there are lots of people who left their addresses because they didn't, who are supposed to pay in the hospitals, and they paid nothing, and nobody can trace them. So tracing people is not necessarily as easy as you might think, me and you may think, because me and you have got addresses, IDs, and all that. Not every human being has got that. That's the first problem. The second reason is that, as I said, for the past 40 years, listeria was not a notifiable disease. So when these patients were treated, it was just on a routine basis. You find somebody with listeria, you give them ampicillin, they go home. You don't take any further details. It's only now that it's notifiable. That, in other words, from the 15th of December, when listeria became notifiable, it will be very easy. Because notifiability means you record the person and you must know where that person is, etc. But because it was not notifiable, it was just on a routine basis. There was no way that people could have been as alert or taken precautions as that. But the most important thing, don't ever think everybody has got an address. As you know, some people are actually illegal immigrants. They wouldn't like any address of theirs to be known. They also will get listeria. So we don't actually know which are these people who have had listeria over the past year, from the 1st of January 2017. But we know that there are 727 because we have got their documents in the laboratory. But to trace a home body to a facility and to a particular home, that is where the difficulty comes. Question 3. Yes, the issue of gynecologists strict. I'm sure you are aware that every gynecologist or every nurse dealing with antenatal care know that pregnant women, apart from the issue of listeria, cannot just ingest anything. Even treatment, before you treat a pregnant woman, even if you are a qualified doctor, you have got to take that medicine, take the package insert, and read whether specifically is allowed in pregnant women. Even when you are qualified, you have got to do that. or whether there are any drug interactions, etc. So, yes, I will say now that we have got Mom Connect, we will include this on the Mom Connect information. We have already been doing so, by the way, let me say, in Mom Connect. When we send these messages, we tell them, at this level of pregnancy, avoid this, don't do that, do this and that. But unfortunately, we can only do it to those women who have registered on Mom Connect. The others, we are hoping their gynecologists and midwives are doing that at antenatal clinics. But it's a very important practice for pregnant women to know they don't just ingest anything, not any medication, not any liquid, not any foodstuffs until they are sure, and they must find out. And we also want to send that message out. The issue of whether it's public or private, I thought I repeated it even in the, I mentioned it even in the first press conference. It's 65-35 now. 65% of the cases are in public, 35% are in private. And we also mentioned that from this data, because only 17% South Africans are using private sector. The fact that there are 35% in the private sector is very high. Our conclusion is that this disease affects everybody, and the food that is causing this disease must be available to all it's available to all the socioeconomic groups. It doesn't matter whether you are rich or poor. That type of food stuff is broadly available. That's the conclusion we can make from this public-private split of 65 to 35%. Whether hospitals are winning in the queue or whether specifically they have resources, they definitely have resources. Listeria is treatable with ampicillin. Ampicillin is a very widely available drug. It has been there for ages. It's not a very expensive drug, so we can't be complaining of resources. So the resources are definitely there. The diagnosis can be made through any NICD, any NHLS laboratory. It doesn't even need NICD itself, which is highly specialized. Any laboratory, which is a hospital laboratory, of the network of the 265 public health laboratories and the 23 private ones, all of them can easily diagnose listeria. That's not where the problem is. The problem is that this is a very virulent organism. It's extremely virulent. Virulent means it's very angry and dangerous. So even if we have got resources, it still remains very dangerous. Thank you. Sorry, there's another question of whether we are winning or not. It's too early to tell. The numbers we are giving you, even the death, have occurred before we took all these steps, because there were no steps taken against listeria before we became aware that there is a change in behavior. So we can't tell whether we are winning or not. For instance, since the press conference, we had 3 deaths. So I don't know whether that is winning or not to say there were only 3 within a month. It's difficult, it's very early days to tell, because we still have to follow up on everybody. Thank you.
Thanks, Minister. Let's check Cape Town first before we come back here. Cape Town?
We have no questions assigned for today.
Oh, okay. Yes. Introduce yourself.
Thank you very much. My name is Mohamed Tubusing, SABC News. My question will be directed to the Department of Agriculture, Fishery and Forestry. That when a patient arrives at the hospital, the virus is detected. That's the end product of where the whole thing started. So what is the department doing? Because all these produce come from farms. Cattle are headed in the farms. Fruits come from the farms. The Department of Health, Department of Agriculture. What is your role?
Thank you. There was a question. Yes.
Good morning, it's Patricia from the SABC. What I want to know is, from the people who have passed on, is there any stats that can indicate how many of them were pregnant women, if there is such a number? And from the ones who are infected, how many are pregnant women? Just to give us an indication, how many pregnant women have died and how many of them are still infected, perhaps?
Thank you. Yes?
Sebastian Mota from Jacaranda FM. Minister, I just want to know in terms of the avatar and sovereign foods. I mean, are there any steps that are, and I mean steps that are being taken against sovereign foods in maybe just trying to locate some more patients that may have consumed or congested the same product? I mean, is the department just going to leave it at that?
Yes, next to you.
It's Karabalans from GCIS Radio. I just want to find out, is there a proactive way, perhaps, medically to prevent the disease? Like you would with your flu, get your flu shots and so forth. In this case, is there maybe a proactive way that you can medically prevent the disease? We're talking about the gap between a person contracting the disease and the manifestation thereof being 3 weeks. So I wonder what happens in between. So is there something that people can do in terms of maybe getting like you would get with your flu shots and stuff?
Are you talking like a vaccine or what?
Yes.
Okay.
That's the last one for this round. Yes.
Minister Alex again from News 24. I just want to, I see DTI is here. I just wanted to ask if DTI has a list of countries that have banned us in terms of their imports. I did see something that Rwanda has put a ban on imports. I just want to know if we have a full list of countries that are doing that. Then you mentioned that you guys had a kind of this stakeholder meeting, and you asked a bunch of these food stakeholders to send samples. You did, however, mention that several of these stakeholders were forthcoming, but not all have responded as yet. Is there a deadline for those that haven't responded, and what are you doing about any possible non-compliance? And I apologize, I just wanted to add on to my colleague, if you do have the stats, if we could understand if we know how many pregnant women have died and how many neonates have also died. So we just add on to her question. That's all, thank you.
The first question is to agriculture. What are they doing? Can you come over here? It will be easier than me migrating all these instruments. I'll give you a chance. No, sit. I'm borrowing you the seat temporarily. Don't feel very comfortable.
Thank you very much. Since the outbreak was announced by the minister in December, what DAF did was then to issue out a directive to all provincial authorities, veterinary authorities, since abattoirs are competencies of province in terms of the constitution. Now the directive instructed provinces to increase surveillance in abattoirs and collect samples. So some of the province people had already gone on a holiday but had to come back and do surveillance. And at this point, we are getting results coming back from provinces, and at the moment, there's nothing that suggests there's any link between what is being produced in abattoirs across the country and the current outbreak. The other issue is on what has been done regarding sovereign food. Another batch of samples was taken after the initial samples were taken, and the results came back. And as the minister has said, the results that came positive are not the same strain as the one that is currently causing the outbreak. But because there's potential for harm by any of these strains, the steps that have been taken was to then issue a non-compliance notice to Sovereign Food under the Meat Safety Act of 2000 for them to then do some action. And the action that they've done is they've conducted deep cleaning on Friday and Saturday and Sunday this past weekend, and that was monitored by the Provincial Veterinary Authority of Gauteng. And the Gauteng Veterinary Authority will be there the whole week this week to ensure that there's deep cleaning of the abattoir, because normally deep cleaning in abattoirs is done once a week. But in this case, it's going to be done every second day to ensure that there's the listeria that is there is eliminated, and the abattoir can then start operating normally. Thanks.
In the meantime, what is it doing to food? because I think that's the question. Can you explain that? Is the abattoir producing food after you give them notice, or what is the meaning of that notice?
In terms of the Meat Safety Act, we cannot close the abattoir, and also this is backed by international benchmarking in terms of even the positive results that came out. When you enumerate them, or the number of positives in a batch of a sample were less than the international maximum limit of 100 colony forming units per gram. So the positives are even below 10 now, which means it doesn't justify the action of closing an abattoir at this point. But then what you do, because Listeria has a potential of being poisonous, therefore you then instruct the abattoir while they're still operating then to do deep cleaning and then collect samples as often as possible, and you monitor them. If maybe after this cleaning the samples are still positive, then that can then justify Gauteng Provincial Department then suspending slaughter, because it means their hygienic measures are not addressing the challenge that is currently there.
Morning, Minister and the journalist. My name is McDonald Nechitenje from the Department of Trade and Industry. I've got no ambition, Minister, to be full-time. So,
about the list, yes.
Yeah, the list. We are collating the list of countries that we do a trade with, but I will just highlight one country, because it's an ongoing process. Brazil, as an example, we import a lot of meat from Brazil. It was found recently that Brazil, the abattoirs, the food processing areas, they were not so hygienic. And then the trade officials interacted, and some of them we have to ban the source of imports, the abattoirs from those areas. So that's where I'm concentrating, trying to answer the question, but it's an ongoing process of collating the statistics of all the trading partners where we may find that unhygienic issues, measures are not happening. But this is not in particular for listeriosis. It's not for listeriosis. It is just a normal trading practices that we should be consuming hygienic food. That's as far as I can answer it.
Yes, the other question is about statistics of pregnant women. I don't know, I'm sure Dr. Juno can help, but the little information I could get, it's not the pregnant women who are dying, it's the neonates actually. The pregnant women do survive, but they are neonates. Because as I said, 96% of them get the disease within the first 6 days of life. So, but Dr. Juno, could you, yes, Dr. Juno Thomas. Oh, come. Come, I'm not, yes.
Thank you. Right, so thank you very much. So as Minister has already pointed out, one of the major adverse outcomes of infection during pregnancy is that the fetus gets infected. And this results in neonatal disease, so disease of the baby, and we call it early onset in the first 6 days, and that reflects that the baby has got the listeria when the mom became infected with listeria. There are other adverse outcomes, however, when the fetus gets infected. So stillbirths and miscarriages and intrauterine deaths are also as a result of listeria infection during pregnancy. Now, although there are obviously very serious consequences to the fetus and the neonates, illness during pregnancy is generally actually very mild, And the majority of pregnant women actually do very well, even if they don't receive treatment. It's the neonates where the brunt of the disease is born. And we don't have comprehensive data on numbers of pregnant women. Unfortunately, when we get case data, we know age of patient and gender, but not always if they are women of childbearing age, whether they are pregnant or not. I hope that answers your question. We don't actually have good data on numbers of cases in pregnancy, nor numbers of deaths in pregnancy.
Yeah.
Thank you.
Thank you. Oh, you should have answered the vaccine, but I'm sure I can answer it. There's no vaccine. There's no vaccine for listeria at all. Not in any part of the world. Yeah, I think all the questions have been answered.
Alex, you want to have a follow-up?
Sorry, perhaps I didn't communicate it correctly. I'm sorry, for DTI, I wasn't asking what bans we are imposing, seeing as Listeria is here. I was asking, according to Rwanda's Ministry of Agriculture and Animal Resources, they are considering a ban on products from our country. So I'm asking...
Because of listeria?
Because of listeria, yes. So I'm asking if you guys have a list of countries that are considering a ban from produce from South Africa, or whether there are any countries that have already instituted some sort of bans?
No, just
Just say no. Oh, he says no. He's not aware of that. But I'm sure that Dr. Chatora can help, because countries don't just wake up and ban imports or etc. It must do it in terms of the international health regulations. So I'll guess it's more of a health question than a DTI question. I don't know whether, Dr. Chatora, you can have a go at it. You may come near.
Well, what I can say is that since the government shared the information with us, we of course activated the systems that needs to be activated in terms of the international health regulations to make an assessment of this outbreak, and also suggest what could be the way forward. And the conclusion of that assessment was that the risk in South Africa, within South Africa, is moderate, which requires a lot of action towards identifying the source and, of course, containing the outbreak. At the global or international level, the risk was rated as low. And if it's rated as low, again, in terms of the international health regulations, normally countries shouldn't start imposing sanctions like that. But we all know that countries are sovereign states. Sometimes they do things even against the advice that is given. We saw that with Ebola. With the information that you have shared, we will communicate and hopefully issue guidance to countries on how to deal with this. While I have the floor, I note that sometimes concern is around raw meats that we eat. But the emphasis that is being placed by the minister and what's coming out of NICD is that it is most likely that the food that is being consumed and then the vehicle for this outbreak are the processed meats that we eat uncooked. I think it's important to emphasize this. And this has been the case in many other outbreaks. And also to underline the fact that in a country like South Africa, to then be able to pinpoint that food, it's not easy. But we all have a contribution to make until this happens. Thank you.
Go on.
Thank you, Minister. Shall we take the last round? And of course, we'll allow the one-on-one interviews after this. Last round. Kintan, do you have any questions?
No, not from us.
Minister, I just wanted to make sure, seeing that it's now being listed as a notifiable condition, is it because you explained that in the 40 years that it's due to its character and so forth that changed, or the unexpected behavior and the rapid spread? Would you say it's the worst one now, or when do we say it's a pandemic, or how can we put it now? I don't know how to put it.
Are you asking why is it notifiable now?
No, you explained that thoroughly. Why is it the worst one in history? Or can we say something like that? Or is it something that you, I don't know how to do it. They're asking me from the office.
I'll leave it.
Yeah, okay.
I'll leave that one to the experts. Come. Yes.
Gina, can I?
Yeah, let's leave it to the experts.
So it is a very serious. Okay, so I think the word pandemic means global, and that's not the case. So this is a very serious, very large, and probably the largest outbreak to date in South Africa. Okay.
Not global in terms of numbers.
Yeah, in terms of numbers. So it's not a pandemic. It's an epidemic.
Okay. We still have, yeah.
I was thinking, Minister, that...
No, it was the last round. I should have allowed the round, unfortunately, because she said she was being asked live. I just said it will be answered. You still have to give them their last round.
Last round, please,
yes.
Colleagues. Yes?
Minister Nico van Buurik, from Plot. Maybe this is also a question for Dr. Molefe. Is there anything that food processors and farmers can do from their side to help fight the disease?
Thank you, Nico. Another question, please. Yes.
Hi, it's me from ENTA. I just wanted clarity with regards to this sequence type, this ST1, ST2, ST5. What does that actually mean? I just don't understand what that means. And if we can't trace the source, how long is it going to take you guys to trace the source of this outbreak? If you have already identified that it's ST6, what needs to happen after that in order to trace the source?
Thank you. Last question, sorry. Minister?
Yeah. I said this is very technical, but I said I'm mentioning it for those who might pick it up. If I may recap what I've said, I said genome sequencing analysis, or WGS, is a DNA fingerprinting analysis. It sees whether particular organisms are related or are of the same sequence type. You know. So, yes, we check it on the DNA. In other words, it's a DNA sort of analysis. And it's done in 3 different isolates. In other words, you can take, it's what is called clinical isolate is number 1. It means you are isolating the organism from the blood of the patient and checking its sequence type. Then you can also do it from the food. You can isolate the organism from food, be it from a food production source or from the home of a particular patient or from any other facility that produces food. And you check the organism then you check its DNA sequencing type. And then the last one is on the environment, as they've mentioned in the abattoir. Specimen you collect not from any particular food or individual, just from that particular environment, the surfaces. You know, there are lots of surfaces where the food is prepared. You take the samples from there, and then you check the sequencing. Now, we said the clinical isolates were represented by 9 sequence types. That means when they examined blood from the patients, they found 9 sequence types, which is ST1, ST101, ST2, ST219, ST5, ST54, ST6, ST8, ST876. Now they found that, however, of this clinical isolate represented by these 9 sequence types, 91% is one type, is ST6. Are we still together? Yes. So we concluded that this ST6, it's the one that is driving the pandemic because it's found in 91% of what has been, you know, isolated up to so far. So our conclusion is that the epidemic is driven by ST6. Sorry?
In the patients.
Yes, in the patients. It's driven by ST6. But then we went further. Is there a link between this 91% of the patients from which the isolate was made? Is there a link to any foodstuff or any environment? And that link has not yet been made. All the food that has been tested, you know, despite the fact that the food and environmental samples, in them, we found 18 sequence types. And only 4, ST1, ST101, ST2, ST5, were also found in the clinical. But we did not find ST6. No ST6 was found. So we can't make a link between the pandemic and the food and environmental samples, at least not yet. Now, your next question is, did you say what is taking us so long or what?
Yeah, to find this, what do you need or what information do you need in order to trace the source of this outbreak?
No, we need as many samples as possible from all the food production side. That's why we said we are concentrating the search in 3 provinces. If you listen to the speech here, I said the MNOR team has met and we said all the food production site in Gauteng, KwaZulu-Natal and Western Cape need to be identified. We continue the search there. That will be the food processing plants. That will be the food packaging sites. Agriculture has already told you they are searching in all the abattoirs in the country because they do have a list of those. So it's just a process of searching. But don't think it's a very easy process, as you have known, because of the variety of foodstuffs, or because, as you remember, my starting statement, I mean, my statement at the beginning is that listeria, this listeria is widely found in nature. You can find it in soil, sorry, not salt, soil. You can find it in water. You can find it on vegetation. You can find it in feces. It's very widely spread. So to you to go and search. In fact, one expert was, when we started in December, was saying, it's actually like searching for a needle in a haystack, if I may put it that way. And it's like searching for a needle in a haystack. And the problem is that we're still looking for the haystack. Before you start searching for the needle, you need to identify the haystack. And we don't even know yet where which haystack is it. That's how difficult this thing is. So it's not a very easy job, despite the fact that scientists have got all the information. Basically, I think the reason is because of food, which human beings have to eat and cannot avoid. I don't know, Lucille, do you want to help? Yes.
So I think Dr. Chitori has highlighted the difficulties in these investigating these outbreaks and has highlighted many of the initiatives that have been put in place. So I think what we have now is very active reporting of patient cases because it's a notifiable disease. There's high awareness of listeria amongst clinicians, so they are submitting cultures, and as soon as there's a positive culture, it is reported. Currently, we are trying to follow up every case as quickly as possible to get a food history, interview patients, but as pointed out, the time from infection to illness can be several weeks, and sometimes the food is not around or people forget what they've eaten. So we're trying to do that. And if we can pinpoint something that may be a suspect food, and that is not easy, then there is some trace back to its source. And at the same time, there is extensive sampling of food processing plants and submission for culture. So it's the sampling, you have to culture, identify the listeria, and then submit it for this genetic sequencing. So all of this is really taking some time. But it's not an easy outbreak. It's serious. Everybody is intensively involved. There are many teams working on this. So I think that's going forward the plan.
Let me just also add what we said on the 5th. While we are talking about 3 weeks or not, or so, the incubation period can be anything between 2 and 70 days. And to go and ask a patient what they ate 70 days ago, even if I have to ask any one of you, you're not going to remember. Yes, if you are sick after 70 days and said, what did you eat on that day and all that, it's very difficult. Because the incubation period is 2 to 7 days. You don't even know that he's sick because of what they eat 70 days ago or a week ago, or, you know. So when we say it's like searching for a needle in a haystack, it actually means it. Actually means it. Yeah?
Real final questions.
Trisha again from the SABC.
I don't want you to restrict them specifically because I don't want rumors when you live here. They must have facts. Yes, I don't want, yes.
Minister, we always say one death is one too many. 61 people have already died. At which stage do we classify this as a national crisis? At which number? Or are we already there?
Well, the fact that we declared it an outbreak and we declared it a notifiable disease shows that we regarded it as extremely serious. We would not have. And I said the reasons for notifiability are 5, and Listeria qualifies in 2. 1, the rapid spread is spreading rapidly, meaning that it will affect many people, and one death is one too many. 2, the issue of unusual or unexpected. It is doing something that nobody in South Africa ever saw for the past 40 years. So this is quite new. So we don't, there's no figure even internationally to say once it arrives at this, we got worried. We are worried already. And that's why it's been notified, that's why we are searching.
Thank you, Minister. Do I see
Sorry? Okay, Lucille want to add, yes.
So listeria outbreaks have been reported from many other countries in the past, from many food sources. And in many cases, the same difficulties in identifying the source have been experienced because of the wide variety of foods and food processes that may be involved, the long incubation from infection to actual disease and isolation of the organism. So this is not unique to South Africa. It's a difficult outbreak to investigate because of the difficulty in identifying a source which could be from many, many different food materials.
Thank you, Paul. Agriculture wants to respond to
the question about what farmers and processors can do.
Oh.
Thank you. In terms of the agricultural sector, I think the biggest thing is for food business operators to observe good manufacturing practices. And that talks to quality and it also talks to safety. And food business operators are also supposed to use a HACCP-based system or hygienic assessment critical control point system in operating their food businesses. Therefore, it's critical that all stakeholders assist government in terms of eliminating this bacteria and all the other pathogens that are possible by observing good manufacturing practices. And this includes the workers themselves washing their hands in every now and then, and also the cleaning of the premises. But also the cleaning of the premises involves proper material to be used, because we find that some business operators would compromise on the concentration of the soap itself, the detergent that they are using. So they will be cleaning, but the cleaning will not be effective because they are not putting the right amount of cleaning material that should be there to, to be able to do proper cleaning. So this is very important. But also because another source could also be manure. And when you're thinking about farmers who are using manure for planting their crops, therefore it's important that all the food is washed properly, and especially vegetables as well, because it could be coming from a potential source of this pathogen on the ground, on the soil itself. So it's important that also that is also observed. Packaging is also critical. After doing all the cleaning, the food must be packaged in a good quality packaging material, but also a clean packaging material that will not break, and especially in this outbreak where you have most of this food being put in a distribution center and you have different products from different farms and food business operators. So it's critical that each one of those food is packaged properly so that there's no tearing of this packaging material, and this can contaminate all the food that will be distributed across the country. So it's important that that is done. Lastly is to observe the cold chain. It's very important that the food, the temperature of the food is kept at refrigeration temperatures for those products that require refrigeration, and for freezing of those that require freezing. We don't want to have a product that is supposed to be called a frozen product, but at one stage the temperature goes above zero and then it thaws and then it goes back to under zero. So those are some of the things that then make it easy for this Listeria to grow in food. Thank you.
Thank you.
Yeah, let me just say my final words. Yeah, I do realize that because of the importance of health and life and sensitivity, generally we may conclude that for every disease that occurs on this planet, scientists must have an answer. It doesn't usually happen that way. It doesn't necessarily mean for every disease scientists are going to find a cure, for instance. Now, I want to warn, because it has happened quite a lot globally, this pandemic might pit out and burn out on its own without us having found the source. Am I correct?
Epidemic.
I'm asking. Epidemic, yes, yes. I just want to check with the expert. The little knowledge I have is that sometimes pandemics do occur. Scientists go and search, they pit out, they disappear, they burn out without us having pointed at the source and say, this is where it must coming from. We must also prepare ourselves for that eventuality. Secondly, there are lots of diseases that have left this planet before without a cure ever having been found, but they just disappeared. Sometimes, well, during due to immunization, but without any treatment having been found. A good example is smallpox. Nobody ever found a treatment for smallpox in the world, even though it disappeared. In 1970, we believe it's for good, but nobody ever found a cure. It's because we're all immunized. But it's not every disease for which there's immunization. So I just want to make those principles for people to be aware, that it doesn't necessarily mean, it's not mathematics where for every problem there ought to be an answer if you get good mathematicians enough. It doesn't happen like that in health. Thank you.
Thank you, Minister. Cape Town. Cape Town, are you there?
Yes, we are.
Okay, for this, I suppose there's no question anymore.
No, we don't have questions.
Okay. Colleagues, on that note, there's going to be a press briefing after this, so we need to vacate the premise. On that note, I would like to thank you very much on behalf of the Minister of Health and the entire team that is driving this briefing. Thank you so much.
Thank you. Thank you.
What has come up?
Yeah, if you have got one-to-ones, can we finish it?
Head injury. I think we need to Sorry.
One-on-one.